Hello and welcome to Economic Divide. I'm Covax. In today's program, we're going to take a look at vaccine inequality, specifically countries that have hoarded it. But we will zoom in on Iran's first domestically developed vaccine, which actually received emergency use authorization recently. The name, COVIran Barekat. Well, coming up in today's program, we're going to take a look, as I mentioned, at vaccine hoarding. Yes, it is still taking place. The US and the UK still stand accused of stocking up. During the G7, 1 billion doses were pledged, but will they deliver? Campaigners say that is not enough. Enter Iran's COVIran Barekat Coronavirus vaccine. Yes, Iran has produced it, ready for administration for emergency. Will Iran be a center for vaccine production and distribution, slated for production in the millions monthly? Then we will take a look at the Covax scheme. You may have heard about it, but it sounds more like a failed scheme or one for richer countries. Why did it fall short when it was supposed to cover 92 countries, starting with healthcare workers and the most vulnerable groups? COVID-19 pandemic continues to take lives. It knows no boundaries, but some countries are drawing them, like rich nations, called the G7. They're the ones that are supposed to lead the world. Why are they failing when it comes to the COVID-19 vaccine?
The United States will purchase 500 million doses of Pfizer's COVID-19 vaccine to donate to nearly 100 nations that are in dire need in the fight against this pandemic.
I'm very pleased to announce that this weekend, leaders have pledged over 1 billion doses, either directly or through funding to Covax. That includes 100 million from the UK to the world's poorest countries, which is another big step towards vaccinating the world.
And we're bitterly disappointed to see the lack of action that's needed. These are 7 of the most powerful countries in the world. You know, what they do matters. And when they decide to do very little and look at spin instead of substance, to cook the books, to cook the planet, then that's just not good enough. So yes, we're really disappointed. They could have done a lot more and they failed.
The G7 nations account for around 40% of the global GDP. That is around $35 trillion. They can certainly afford to have the whole world vaccinated. When it comes to the doses needed, 11 billion.
This G7 is meeting as the pandemic still rages. Vaccine justice has to be at the top of their agenda, and that means 3 things. The G7 needs to share doses, it needs to share technology and know-how so that we can scale up manufacturing capacity, but most of all, they need to share the bill. We've estimated it costs anywhere between $50 and $66 billion to vaccinate the world. That's what they've said they want to do, so now it's time for
The G7 meeting held recently really let the world down when it came to COVID vaccines. They were slammed for falling short, from campaigners to health organizations. After all, the group of 7 wealthiest nations, by definition, are the ones who can afford to provide vaccine relief for the countries that need it. The UN's Emergency Relief Coordinator slammed the group for failing to come up with a plan to vaccinate the world against COVID-19.
What the G7, I think, should have done was develop a genuine global plan to vaccinate the world. It would cost, the IMF has worked out the cost of this, it would cost around $50 billion. It could be paid over a period of years. That, by the way, is the deal of the century, because until the pandemic ends, everybody is going to face huge risks and potential problems. So these sporadic, small-scale charitable handouts from rich countries to poor countries is not a serious plan. It will not bring the pandemic to an end.
The World Health Organization chief also weighed in and said the G7 nations need to do more to deal with the global COVID crisis.
I welcome the support expressed by the G7 for WHO, the ACT Accelerator, and the idea of a treaty on pandemic preparedness and response. And I welcome the announcement that G7 countries will donate 870 million vaccine doses, primarily through Covax. This is a big help, but we need more, and we need them faster. More than 10,000 people are dying every day.
Let me bring in Norman Stockwell here. He is a radio host and political commentator. He is also the publisher of the Progressive magazine, which has the slogan, "A Voice for Peace and Social Justice," since 1909. Norman, welcome. Well, the fact that the world's wealthiest countries are getting vaccinated by as much as 25 times faster is not new news, but the fact that this is continuing is. Why do countries like the U.S. continue doing this? Do they not realize that the vaccine has no boundaries?
I think that the amount of doses being offered are absolutely a drop in the bucket. And we've seen certainly here in the United States that the country was very, very cautious about releasing doses, hoarding doses really, of the vaccine for a very long time, partly with a notion of protecting the local residents first before sharing vaccines with the rest of the world. And I do think this is a very short-sighted approach because the vaccine does not know boundaries.
We're headed for a quick break here on Economic Divide, but don't go anywhere. We'll be right back after a short pause. For in-depth section, we are going to take a look at what's called the Covax scheme. Now, you may have heard about it. We will also take a look at how Iran's COVIran Barekat fits into that. Now, Covax was created to ensure that COVID vaccines were made available around the world. That's why they created this somewhat of a bank in order to reach that goal. Now, richer countries, they had promised subsidizing costs for poorer nations.
I really believe we need to ensure access, availability and access to vaccines throughout the world, not just in the countries who have the means to pay for them.
Well, that is easier said than done. But the goal of the Covax scheme actually centers on distribution. In terms of the distribution, what is their goal? Where they have said that they want to have 20% of the world population to be vaccinated. That would be spread to 92 countries. The 20% is the maximum limit set by the administrators of Covax, like WHO. When it comes to the number of doses, its initial goal is 2 billion, and that's the number of doses for the year 2021. For the year 2022, 1.8 billion doses. But so far, only 4% of the more than 2 billion shots administered worldwide to date have been administered. Now, based on the math that we have calculated, that means that only about 80 million out of the 2 billion doses has been administered.
This terrible pandemic, and I think emergencies require innovative solutions. We're simply not getting enough vaccine to poorer countries. It's so slow, and we have to do something about it. Okay.
Obviously, Covax is conditioned that no country will receive vaccines for more than 20% of their population before others has failed miserably. Why? Well, the short answer, wealthy countries bought most of the new vaccines before they were even approved by regulators for emergency use by Covax. Those countries, well, the UK, Canada, UK, and also France. Well, it's the perfect time right now to take a look at the world map to see how much of each country's population has actually been vaccinated. Now, this is the map as of June 15th, the latest data available, the source official data of our world. Canada, for example, has 65.4% of its population to have been vaccinated, Canada being one of the G7 countries. That is one of the highest of their population to have been vaccinated. The U.S. coming in second, 52.2% of their population to have been vaccinated. Now, keep in mind that these are the first dose of the vaccinations, so the double dose figure is still something that needs to be administered. Next comes Chile in South America, coming in at 61.4%, and we can see Brazil, very low percentage of their population, of its population to have been vaccinated at 26.6%. The UK, high figure, 61.6%. Now at this point, the double dose there has actually been administered to that percentage of the population. Next up, France, 45%. Keep in mind, UK, France, Canada, the US, the G7 countries, obviously wealthy nations, are able to not only hoard the vaccine, purchase it, but to administer it then to the population on a wide scale. Israel, 63.4%. We reported in one of our other programs about how Israel paid top dollar and top money to buy the vaccination from manufacturers. This is the sad one. Kenya in Africa, 1.8% of the population. Why does that have to be that low? Again, Africa has been one of the victims, along with many other countries, not to get enough doses. Russia, one of the creators or one of the manufacturers of the vaccine, coming in at the figure that you just saw, 12.7%. India suffering so much. We're looking at 15.1% only of the population to have been vaccinated. And then China, this figure actually got updated just right before we ran the program. It was at around 15%. It went up to 40%. They actually hit the 1 billion mark in terms of the number of people to have been vaccinated. So there you have an overview of what has happened around the world. Now, where does Iran's COVIran Barekat fit into the picture? Well, let's take a look at the production numbers first of what has been produced and what is projected. This is the actual number to have been produced for the month of May, 1 million doses of COVIran Barekat, which will go then up to 3 million for the month of June, followed by the month of July, 10 to 12 million. You can see a big jump there. And then for the month of August, we are looking at the figure 13 to 15 million. Now, this would have been a lot easier had there been no sanctions on some of the chemicals, for example, and other things that were needed to develop the vaccines. Which brings us to the question, is it the strategy of the U.S. and other Western countries to continue sanctions to prevent Iran's advancements, like in vaccine production, for their own benefit? Well, let's bring in Ahmad Kiai. His Twitter address, @ekiai. He's the director of the Middle East Treaty Organization, one that seeks to eradicate all WMDs from the Middle East, who joins us now to give us his thought on this. Ahmad Kiai, when we take a look at the countries that have actually, I don't want to use the word hoarding, but that's what they have been called in terms of what they have done. US, UK, and France, for example, and Canada. These are the G7 countries. Why are they not seeing the bigger picture in terms of how their nationalism has taken over their logic to prevent people from dying? Why has that happened?
The truth and the frank answer to this is power, influence, and the vaccine diplomacy or political pressure that it comes with the distribution of such vaccines. The Western countries have to realize that by hoarding these vaccines and not allowing for a fair distribution of it, they are also hurting themselves. It is not a charity for Western countries to open up the gates to the distribution of vaccine. It is in their national interest, actually, to be able to have this pandemic brought into control and for economic revival on a global scale to occur, because we are interconnected. So I think that it is a missed opportunity for the Western countries and industrial countries to take advantage of the fact that they're able to then provide a helping hand in bringing this pandemic to an end.
ما دیروز اجازه مصرف اضطراری رو کمیسیون قانونیمون داد به مجموعه برکت که از امروز میتونه توزیع بشه مقداری که تولید کرده و از هفته آینده انشالله به چرخه واکسیناسیون کشور اضافه بشه.
Major announcement, a major breakthrough. It finally paid off. After a year of intensive work, Iran has joined the club of countries in the world with the capacity to produce COVID-19 vaccine. The COVIran Barekat Coronavirus vaccine to have received approval for public inoculations for emergency use. COVIran Barekat was unveiled on December 29, 2020 and started to be mass-produced on March 29.
پایان اردیبهشت این 1 میلیون رو تحویل خواهیم داد. در خرداد این بین 3 تا 4 میلیون واکسن رو باز تحویل خواهیم داد. در تیر این به 10 تا 12 میلیون خواهد رسید.
It's been developed by Shifa Pharmaceuticals, a subsidiary of the Iranian economic and industrial conglomerate Setad. The factory says its production capacity will reach between 12 to 15 million doses per month in the summer. Out of 16 vaccine production cases, 4 cases have received the Code of Ethics and are undergoing clinical trials. It is hoped that another 3 to 4 cases will succeed, receiving licenses by September. COVIran Barekat vaccine developers are planning to get the approval from the World Health Organization for the Iranian vaccine to be listed as one of the safest COVID-19 vaccines for emergency use. Iran is also currently producing vaccines jointly with 3 countries, Cuba, Russia, and Australia, and all of this while it's been under sanctions.
Something very interesting has happened recently which really poses more questions than answers. Now, as of June 19, the European Union opened its doors to Americans who were either vaccinated or not. Yes, you heard it right. The European Council updated its list of countries whose citizens and residents should be allowed to travel freely to the bloc's 27 member nations. Now, does this mean that this is now a way for countries like European countries to contain the flow of the population inside its borders? After all, Europe has been very keen to stop the flow of migrants, just like the U.S. Joining us for this segment is Shaho Abar, who's a lecturer at the University of Tehran. He's also a member of the UNESCO Chair on Cyberspace and Culture. And we also have Ahmad Kiai, who's the director of the Middle East Treaty Organization, who's rejoining us for our three-way Q&A. First, I want to talk to you, Shaho. Countries like Iran, maybe that's the answer here. Iran is ready to apply the COVIran Barekat vaccine for emergency use among 4 vaccines that are being developed in Iran to tackle the pandemic. Iran has also announced that it's going to be ready to ship the vaccines in a few months. What do you think?
Well, I believe vaccines are among the most strategic products in any country. So you look at Iran's situations in the past 4 years, and you see, well, Iran was under a lot of pressure. Iranian people suffered a lot because of the sanctions and because they were not able to get their hands on important equipment, medical equipment, and important medicines fast enough. Right now, Western countries, and especially the United States, claim that, well, no, we haven't, with our sanctions do not apply on specific stuff like medicines. But the fact is, when a country is under a lot of pressure, under so many sanctions, and under the so-called maximum pressure policy, any kind of purchase would be delayed. No kind of purchase can be fast enough, especially when it comes to important medical stuff.
Okay. Well, Ahmad, let me come to you. I'm going to address this in a different way in terms of what Iran can do. Ready to supply the COVIran Barekat vaccine. It has been approved, as I mentioned, by the country's health ministry for emergency use. And COVIran Barekat is the top candidate among 4 vaccines being developed in Iran to tackle the coronavirus pandemic. Announced also Iran to be ready to ship the vaccines in a matter of months. Doesn't this break any idea of how Europe or the U.S. maybe has a monopoly on this?
Well, it shatters that idea that only developed or industrialized countries have a monopoly over the vaccine and its production. We have to congratulate Iran and other countries such as Cuba and other developing countries who have advanced in developing their vaccines. However, here is an important note to make that while Barekat is being spearheaded for Iran to vaccinate the population, there is other mechanisms to be able to speed the distribution of vaccines to the population of Iran, in addition to Barekat, of other vaccines that are in development. So I think that while Iran has showcased to the international community that under extreme conditions of sanctions, of economic hardship, and the pandemic itself, it's been able to make this breakthrough. But I believe that it is also in the essence of it. We know that Iran has also indicated that when it goes into mass production for the Barekat vaccine, that it's open to providing it to other countries. Now, this is phenomenal, because a country that is already in dire situation is still saying that if we are able to make this vaccine at a high level in production, we will be open to providing you, other countries, low-income countries, with this vaccination.
This is our InfoNews section, where we inform you of other economic news from around the world. First up, let's take a look at this piece of news that caught our attention. It's based on the G7, and it's the G7 anti-China stance. In their final communique, they rallied around the need to counter and to compete with China. One way of doing this, the G7 aims to counter Xi's Belt and Road Initiative. It's known as the Build Back Better World, B3W for short. Price tag, $40 trillion to counter China's Belt and Road Initiative. Let's see if that works out. Where's the money going to come from? Okay, next up, the world's displaced, very important topic. Global displaced population hits an all-time high. At this point, that all-time high is roughly around 82 million, as you're about to see. This figure of 82 million, which is the number of displaced, just came out in the most recent report. And that article said that it's a tragedy how so many children are being born into exile. That obviously needs more of an effort to prevent and to end conflict and violence. And it's been called an epic failure of humanity because it's one of the highest numbers. All right, next up, the topic child labor setback. Why? Because the U.S. High Court actually is really something to be worried about, because the U.S. High Court has sided with corporate giants, in this case, Nestle and Cargill. And that is a child slavery case. The lawyers for the plaintiffs have argued that Nestle and Cargill have total control over the production of cocoa in Côte d'Ivoire, where child labor is very widespread. Moving on to our final story, it's another actually court case, this one happening in Brazil. A bill backed by the country's farm sector would limit the recognition of reservation lands. The legislation was first tabled back in the year 2007, and that would actually assign the year 1988 as the cutoff date for the demarcation of reservation lands if they were not occupied at that time. This has been called an unacceptable setback for indigenous rights, especially for their lands. So here we are. As we speak, people are dying by the minute around the world. This is the WHO chief speaking just on June 15th.
During this press conference alone, more than 420 people will die.
Quite shocking, isn't it? Let's not forget another alarming factor, variants. They are popping up around the world. So, on the one hand, you have the COVID-19, and then you have the variants as well. Then you have countries that have had the first jab, but not the second one yet. And if they don't get it in time, well then, they're going to be susceptible to catching the disease. And then you have countries like the US, UK, or the G7 bloc saying that they will pledge 1 billion doses, worried about patents and money. I ask you, do they see the severity of the situation? What is truly surprising is that they don't even see how this vaccine hoarding hurts their own pockets. Many of these developing nations have their headquarters of the factories in these developing countries which produce their products, from clothes to you name it. Now, Iran is ramping up its production of COVIran Barekat, and God willing, it will reach a volume enough for worldwide distribution. The U.S. needs to remove its sanctions, however, to save human lives, if that is something that figures in its calculations. That does it for this edition of Economic Divide. Your questions and comments are always welcome. Thanks for being with us for this edition. From me, Barekat Coronavirus, and the entire team, it's goodbye.